When you approach a patient presented with a tonic-clonic seizure, it is important to ask the patient whether has been suffering other type of seizures like myoclonic seizure, absence seizure, or focal seizure, as the patient could not concern for these type of seizure and did not seek medical advice before. Juvenile myoclonic epilepsy is one of the most common cause of idiopathic generalized epilepsy syndrome. It accounts for about 9% of all epilepsies and 27% of all idiopathic generalized epilepsy syndrome. There are common features of a juvenile myoclonic epilepsy. First, three seizure types: a generalized tonic-clonic seizure, absence seizure, and myoclonic seizure. Myoclonic seizure often occur shortly after awakening and after precipitating factors like sleep deprivation, alcohol use, or psychological stress. 3. Normal intelligence and normal neurological examination. 4. Characteristic EEG findings. The correct diagnosis of a juvenile myoclonic epilepsy can avoid inappropriate and ineffective treatment. Lifelong treatment usually required for patients of a juvenile myoclonic epilepsy. Avoidance of precipitating factors like sleep deprivation, alcohol use could be useful in patients of a juvenile myoclonic epilepsy, but it's not sufficient to control the seizure. In most patients, the seizures are well controlled with monotherapy. Valproic acid have been considered the treatment of choice in the patient of a juvenile myoclonic epilepsy. However, several studies using levetiracetam, topiramate, and lamotrigine show the similar efficacy of valproic acid to control the seizures and better tolerability. There are some anti-epileptic medication should be avoided in patients of a juvenile myoclonic epilepsy, as could provoke the myoclonic jerks and absence seizure. For example, carbamazepine, phenytoin, phenobarbital, gabapentin, and pregabalin can provoke myoclonic jerks or absence seizure, and it's better to avoid it in patients of a juvenile myoclonic epilepsy. For lamotrigine, it's known that lamotrigine could provoke myoclonic jerks and should be used only if there is contraindication for valproic acid or levetiracetam in patients of a juvenile myoclonic epilepsy. So, in conclusion, it is very important to consider the diagnosis of a juvenile myoclonic epilepsy, as there are some medication should not be used in the treatment options like carbamazepine, phenytoin, phenobarbital that usually used for other type of seizure